In Southern California recently, more than 2,000 people who are unable to afford health care services waited in this line, some for up to 2 days, for medical and dental services performed at no cost by a small army of volunteer doctors and dentists donating their services. These are some of the 40 million Americans today who remain without health insurance or who are underinsured, relying on charity healthcare clinics like this one organized by British-born philanthropist Stan Brock.
You can't have 45 million citizens in this country who are not able to have access to the system. Simply can't afford it.
Brock could afford to start helping those in need after a career in TV as the rugged outdoorsman co-host of the popular 1970s wildlife program called Wild Kingdom. Brock says the notion of helping people without medical care came to him after he injured himself while on horseback in a remote region of South America and found himself 26 days away from the nearest medical help.
So it seemed to me at that time that maybe we needed to bring the doctors a little bit closer than 26 days on foot.
Remote Area Medical, a nonprofit mobile healthcare clinic, was founded by Brock in 1985. That he says has since provided free health care to hundreds of thousands of Americans needing medical attention. Many living in remote rural areas, and some areas not so remote. For example, this particular event where CCTV met up with Stan Brock is being held inside the Anaheim Convention Center, just across the street from Disneyland.
Yeah, I don't think these people are going to Disney World. 95.
Brock and his staff, with so many patients waiting in line, welcomed them through the doors here 100 at a time.
And 100. Holding at 100. The overwhelming preference for the people that come to these events is to see the dentist. And second to that, it's to see the eye doctor and get a pair of eyeglasses. But we always try to persuade the patients to take advantage of all the other services that we have here.
This 3-day health fair sponsored by the city of Anaheim provides everything from blood work to acupuncture to free mammograms and pap smears. But as Brock points out, the majority of those here come for vision care and dental work. Brock's Remote Area Medical, or RAM for short, provides over $1 million worth of donated vision care and dental equipment he trucks in from his headquarters in Knoxville, Tennessee. And RAM recruits dozens of dentists to come here and donate their services for patients Brock says are mostly working class people with jobs but with no dental coverage.
It's not just homeless people, it's not just poor people. It's people that have jobs, but they don't have any coverage, and it's very expensive here in the United States for people to be able to go to the dentist. And so if you don't have dental insurance, well, your options are you've got to pay for it at the regular rate, which is very expensive, or you're going to look for a service such as ours where you can get it done absolutely free.
Free dental work, as simple as having a tooth filled, that many patients here could not otherwise afford. How much would that cost normally?
This kind of filling normally takes about $225 in a private practice. Okay.
It's a lot for some people.
It's a lot of some people.
Some people, like Anaheim resident Rena Sanchez, who says as a nanny with no health insurance, has put off visits to the dentist for nearly 20 years, choosing to feed herself, she says, and pay bills instead of paying to have a wisdom tooth pulled.
I don't have insurance and it's too expensive. You want to go to the dentist to fix these problems or to have to eat. And really it's too expensive. I prefer to eat.
But then Rena says she heard about Stan Brock's free clinic on the local news. And at this moment, she is about to finally have her wisdom tooth removed by a team of volunteer dentists.
It's a wisdom tooth. It's trapping food. It's decaying, so we have to remove it. She has no function on it. She's not chewing on it.
How much would that cost if she could?
If she would get this done outside, it would probably cost maybe $150, $200. This you don't feel anymore, huh? Tiene dolor? Nada. Okay, good.
Within 15 minutes, the tooth that has caused Rena so much pain for so many years is successfully extracted.
Es todo. You want to give me another one? No, it's okay.
I'm happy. I just so happy and I hug them because I'm so exciting.
Take care.
I'm so really happy. Then they help me with my teeth problem.
Take care, dear.
God bless Stan Brack for help us.
I mean, I can't honestly say that it sounds much different.
Healthcare in the United States is the finest in the world, if you can afford it. And that's where the problem is.
The problem, says Brock, is that under the Obama administration's recently passed Affordable Care Act,
more of our people are insured than ever before.
known as Obamacare, millions of Americans remain underinsured.
That it doesn't provide dentistry and vision care and eyeglasses for adults. Welcome to America.
Brock recently went to Washington telling U.S. elected leaders that America's health care system must cover everyone in society.
What the politicians need to get over is the feeling in many circles that that this is some kind of socialism, which seems to be a word that doesn't go over too well here in the United States. As far as I'm concerned, healthcare services are like the fire department, are like the police department, are like the military. These are essential services that every country has to have. You've got to have the military, you've got to have the police force, you've got to have the fire department, and so why not have the services to provide health care for the public? People pay taxes. We've seen hundreds and hundreds of thousands of patients. It's quite common for patients to come to one of our events 48 hours before the event starts. They'll bring a tent or some kind of shelter and a mat to lie on out there in the street, waiting 48 hours for the event to open.
Many of the patients here in Anaheim also arriving early for a chance to be treated.
So the patient that we have in chair, he's been waiting since 5 o'clock in the morning, and now we're just going to start treatment.
Dental assistant Kathy Tren is one of 85,000 medical practitioners who've donated their services for remote area medical over the last 30 years. Most doctors and assistants at this event from in and around California. Some of them bilingual Spanish speakers for the high concentration of Latino patients. Other volunteers like Kathy Tren speak Mandarin to help Chinese American patients here.
我的名字就是陈美凤，我是从加拿大来，但是我的家里的人都是武汉人。武汉你好。
What did you say?
Oh, I'm from originally from Toronto, Canada, but my parents are from Wuhan, China. So shout out to Wuhan.
Dental assistant Kendra Rosenberger showed up here today, not as a volunteer, but as a dental patient, badly in need of a filling that her own health insurance, she says, doesn't cover.
I'm actually a dental assistant, so it's pretty interesting that I have to come here to get a filling in my mouth done because I'm not able to, somebody's not able to give me the time at my work to take care of it for me that doesn't provide you with dental or medical coverage. Well, it's just sad. I've seen a variety of people today. I've talked to many people while waiting in line, and it ranges from young to the elderly, and they don't have coverage. You see people who are veterans, people who have served this country, and they don't even have the health care that they need.
And who pays for all of this, by the way? Brock says remote area medical receives no government funding, obtaining all of its equipment and paying for shipping costs through public donations, many of which come through the organization's website, ramusa.org.
Funds that are donated by the general public. So it's those $5, $10 checks from the general public who want to support what we do.
Brock unabashedly defends the free healthcare services he provides, even when some political leaders in Washington, he says, may be critical of him for exposing what some consider the rather embarrassing downside of the healthcare system in the United States.
Is there a downside to what we do? Well, the downside is, why the heck is it necessary in the first place?